Hey everybody, it's been a minute since I have done an episode. This is just a little preview as to what I'll be talking about in the next episode that I'm going to release. It's going to be about menopause because I don't feel that it's being talked about enough. I don't really see it being talked about at all, to be honest. It's just a conversation that I have amongst women who are going through it, who I, happen to be friends with, or, I actually posted about it once on Facebook, and I got an very much welcome surprise of feedback on that post from women who are experiencing it. So if you are a woman who is of age where you're going through menopause, or if you're married and you're going through it and it's affecting your marriage, or you're in a relationship and it's affecting your relationship or your dating life, then you're gonna wanna tune into this episode, the next episode rather. So I'll see y'all then. Bye bye. Hey y'all, welcome back to another episode of Kicking It with Coco. I am your girl Coco, and I know it's been a minute since I have released an episode for my podcast, but life has been lifing, and I wasn't feeling it. Like I just wasn't. So I'm back, and I am in a better space mentally than I was than I have been the past few months. So we will get into the episode. Thank you for tuning in, by the way. Thank you for your support. I just wanted to say that real quick. Now, let me drop my disclaimers. First of all, anything that I talk about on my podcast is based on my opinions of people that I know, my friends, both male and female, or it's also based on research that I've done and opinions that I have found within that research. So that's one. And for this particular episode, I need to drop another one. And because this episode is about menopause, I just wanted to say that I am not, nor do I, or ever will I, claim to be a physician of any sort. This is just research that I've done, and I might even throw my own personal experiences in here in this episode, or maybe in part 2 of this series, because it's a lot of information about menopause that I have a lot of things that I would like to share about it. So on that note, because I'm not a doctor of any kind, and I don't claim to be one, for further information about menopause, any questions that you have about menopause, anything that you are experiencing about menopause that is a cause of a concern to you, consult your doctor. Take those concerns to your doctor, because I am not one. Okay? Now, let's get into the episode. Okay, so this is part 1 of my menopause series, and I wanted to talk about this because I don't feel that it's talked about enough by women, by just in general. I don't think enough conversations are being had about it. At least I haven't seen or heard any. And that kind of bothers me because we don't stay young forever. And there are a lot of women who are in that age range where they are going through menopause, or they're transitioning into it, or they have experienced it and they're done with it and they're just, living their life menopause free right now. So, I just felt that it was important to have the conversation because, like I said, we don't stay young forever. And by my mother passing away in 93 when I was 16, these are conversations, this type of conversation rather is a conversation that I didn't get a chance to have with her. My mother started talking to me about my body when I was probably in like 3rd or 4th grade. So I was probably like 9 or so, like something like that, 9 years old. She bought me books and we would have conversations from that point all the way up until I got to be a teenager. And sometimes the conversations were not, they would just come out of the blue and they were awkward. And I would be like, okay, thinking like, I don't want to talk about this, but I knew what she was trying to do. So I wasn't one of those girls who got their first period and was freaked out. I knew what it was. I didn't panic. I wasn't in the bathroom thinking I was dying. I knew about, my mother talked to me about sex. My mother talked to me about everything. We had all kinds of conversations about sex and the way, my body was going to start changing, about life in general, about boyfriends, husbands, just about, those types of things. But menopause, come on, like, you're not thinking to tell your 9-year-old child about menopause or your 15-year-old child about menopause when she's at an age she hasn't even experienced anything related to that yet. Like, I was so young. So that's a conversation that I didn't get to have with her. And I'm sorry, y'all, I am in my car. And I don't know if you heard that or not, but somebody's car alarm was going off. Anyway, I didn't get to have those conversations with her. And for that, I feel like I was shortchanged. And it's not of any fault of hers, because my mother dropped a lot of gems on me. And I'm grateful for the ones that she dropped. But it is hard to grow up without your mother, with the things, experiencing the things that you experience as a young lady and as an adult woman. Like, even now at 47, I still need my mother for things. I still need to talk to her about things and get her opinion and her advice, and I don't have that. And I don't really have any woman that I can talk to like that, as far as like a mother, like motherly. I don't have that. So I rely on the experiences that I have on my own, that I can, and I compare those with those of my friends. And, sometimes in certain, maybe like groups that I'm in on social media, things like that. But okay, that's basically where I fall in the the realm of menopause, like, and just basically anything about womanhood, I have to refer to the things that my mother was able to share with me, and then everything else I just experienced it on my own, and I just learned, from, my OBs and my, like I said, comparing experiences with my friends and, reading and things of that nature. I do have aunts, but when my mother died, I just, no one really reached out to me like that. So, yeah. I mean, I take that back. My Aunt Joyce she was superb. She did reach out, so I take that back. She was amazing with that. But anyway, let's just dive into what I have found about menopause. So, this is part 1, and what I am going to share with you first. Okay, so menopause, I like I said, I did my research. Menopause is described as a natural decline in reproductive hormones when a woman reaches her 40s or 50s. It is signaled by 12 months since the last menstruation. So, once you have gone 12 continuous months without a period, you are considered to be in full-blown menopause. Treatment. Oh, let me back up, y'all. Okay. And then I also found that more than 3 million cases per year are diagnosed. More than 3 million cases per year. That's a lot of women. Treatment can help. There is no cure. It's usually self-diagnosable, and lab tests or imaging are often required. And those are just done, as we know, doctors run tests and do all types of imaging for us just to confirm or deny, like, this is what it is, or it's not what you thought it was and it's something else. So now we have to do further testing. But usually, just to make sure that that's what's happening, they are going to do some testing. Most women experience it between 45 and 55. It's caused by the loss of ovarian follicular function and a decline in circulating blood estrogen levels. Okay. That was... When I read that, I was like, wow, you just, like, as women, we know that all of, like, our bodies do all of these crazy things as we get older. But when I read that, I was just like, wow, 45. When I was, like, in my 20s, in my teens, I thought 45 was old. When my mother was 45, I was just like, okay, she's like getting kind of old. But looking like now that I'm 47, 40, and I'm like, dang, 45 is not old. That's not old to me. So to start experiencing something like that between 45 and 55 is crazy. Okay, it is also... back up. I said it was, it's also caused by a decline in circulating blood estrogen levels. The menopausal transition can be gradual, usually beginning with diagnosis in the menstrual cycle. So once you are in your 40s and you start having irregular periods, which you can no longer predict, you are probably heading towards menopause lane. You're probably finna go down that road. Okay? As women approach their 30s, I remember reading this and I just thought I would insert this right here. As women approach their 30s, their bodies start making less estrogen and progesterone, the hormone that regulate menstruation, causing a decline in fertility. Okay, the hormones rather. So those hormones regulate periods. And when our bodies start to produce less of those hormones, it causes a decline in our fertility. So that's why they say once you reach your 30s, that clock is ticking, because women are born with all the eggs we will ever have in life. You don't get more eggs. You can't get any more. Nobody, can, produce any type of magical trick for you to have more eggs in your body. Okay, somebody can, you can have your eggs frozen and then fertilized, but that's a whole nother conversation. But for the most part, when it comes to, not even for the most part, but actually, when you are born with all the eggs in your body as a woman that you will ever have. And that is why when you reach your 30s, they say if you haven't had a baby by the time you reach your 30s and you want one, you're going to have to hurry up and decide what you're going to do. Because a lot of women feel like they have all the time in the world to have children, and they don't. A lot of women don't know that they can't. Some women end up finding out that they can't even get pregnant, that it's hard, like they can't have kids. And this is something that, as you become a grown woman, as you become an adult, and you're a woman who wants a family, you don't think about, I might not be able to have kids. No woman is walking around thinking like that she can't have kids. You might think it might be hard for you to get pregnant because you probably haven't gotten pregnant, or if you are a woman who has taken birth control ever since she started becoming sexually active and you've been on that shit like clockwork, you haven't missed a beat, you would especially not know that you can't have children. But there are women who decide when they get married, or even if they're not married, whatever your situation is, whatever their situations are rather, and they decide, now I want to have a baby. Okay? And they feel like, okay, I've done what I was supposed to do. I have my career established. I got my coins together. I'm ready to have a baby. And, they might be in their 30s. So they're not thinking, I might not have a baby. When they're getting their lives together, they're not saying to themselves, I might not be able to have any kids, so I'm just not going to have any. Or I might not be able to have any kids, let me rephrase that. They might not be thinking, I probably can't have children, period. That's what they might not be thinking. They might not be thinking that way. A lot of women are not thinking that. They're just thinking, okay, I got my shit together. I want a family. Let me start, getting ready to have a baby. And then they start trying, and it's not until they go so long with a negative pregnancy test till they realize that something is probably wrong. And that's when they go and find out whatever information it is that they find out, and it's devastating. So I just had to throw that in there because of the fact that when women reach their 30s, the fertility level goes down. And if you get pregnant past the age, I think it's 35. It was 35 when I was having kids. Okay. You become high risk for a geriatric pregnancy. like they say that you're up there in age, like you are now high risk because you are considered over the average age of childbearing years. I don't know if it's the same age. I didn't look it up. I'm just going off of what it was when I was having kids. Okay, so the stages of menopause are these. Now, during perimenopause, menstruation periods become more irregular and begin to taper off. Now, after, like I said earlier, after you haven't had your period for like 12 months, a woman is considered to have reached menopause. Okay, so the symptoms are, like I said earlier also, a little while ago in the beginning, symptoms are usually self-diagnosable. Now, the common symptoms include hot flashes and vaginal dryness. There may also be sleep disturbances, and the combination of these symptoms can cause anxiety and depression. So, as people, period, we need sleep. Most of us need a decent amount of sleep. A lot of us suffer from anxiety. I didn't even think I had anxiety until I had to pick my daughter up from work, and I had to take a new way on the freeway, and it was nighttime, and it was super foggy outside. Now I had already had to pick her up like a couple of times before that, taking this new route, but I couldn't see. Now, I'm the kind of person where when I have to take a new route somewhere and it's on the freeway, I need my GPS. I need my GPS anywhere where I don't know where the hell I'm going, but especially on the freeway, because I need to know exactly where the fuck I'm supposed to get off. I hate missing an exit. I hate it. Okay? I can't stand it when I miss my exit. So, I need my GPS. Now, imagine it's nighttime. You haven't really taken this route too many times. It's extremely foggy. It's so foggy to the point where you can't even see if anything or anyone or any vehicle is in front of you until you get about maybe 2 feet behind this, whatever it is. You can't even see. That's how bad it was with the fog. So I had to, get the hang of this route because I had only taken it when it was dark outside. I hadn't, seen it in the daytime yet. So it's nighttime. I'm taking a new route. It's super foggy. People are driving like fucking maniacs. Still, they don't give a fuck. Now, you already can't see because the fog is so dense. But now you on the freeway and you can't fucking see. Okay? So my anxiety, that's when I realized that I had an anxiety issue, because I was starting to freak out on the inside. But my sons were with me, and I didn't want them to know that I was having damn near, I don't want to say a panic attack, but I was like really going through it. And it might not seem like a big deal to anyone else, but in that moment, I was really about to lose my shit. But I had to keep my composure so I didn't have an accident. So that's when I knew that I had an anxiety issue. Now, that can be like anxiety and depression that is caused by menopause is a whole nother issue, because menopause is an everyday thing. It does not stop the show at all. It is every dang on day. Some days are better than others. Some days, some days you might not feel it. That's why I say some days are better than others. Some days you might not even realize you're going through menopause. And then there are days where you gonna realize it all damn day long. You might realize it all damn day every day. So that's why I say some days are better than others. Now, treatments depend on the severity of menopause. It's a natural process with treatments that focus on symptomatic relief. Now, vaginal dryness is treated with topical lubricants or estrogens. That's one of the main things that I have heard about menopause. I'm not experiencing that. That's not something I'm going through, at all. And I am praying that it stays that way, because I would like to continue to be the way that I am down there. Okay. So the medications, let me back up, y'all. Okay, so it's treated with topical lubricants or estrogens, and the medications can reduce the severity and frequency of the hot flashes in special circumstances. Oral hormone therapy may be used. So you have topical and then you have oral. So depending on how severe it is, that's what the doctor, that's how they determine which one they will prescribe for you. Estrogen treatment is the most effective treatment option for relieving menopausal hot flashes. Now, some forms of menopause hormone therapy may cause monthly bleeding. So, depending on what form you are, prescribed, you probably will start to bleed every month again, just like you're having a regular period. Yay for that. Yeah. Okay. And also, these therapies may include, they include cyclic hormone therapy preparations that contain a combination of estrogen and progestin. Progestin helps protect the uterus from endometrial cancer if you have an intact uterus. These are, women's bodies go through so much. We experience so much shit internally on levels of intensity that no one who is not, and I don't care how offensive this sounds, if you are not a woman, and I mean biologically born a woman, this is shit that you cannot, and this stuff, menopause, this shit is crazy. There are some women who go through it and it doesn't affect them at all, or it barely affects them. And then there are some women who go through it and their life is a living hell every damn day. It just has completely disrupted their daily lives. And that's why I'm saying that if you were not born a biological woman, you will not ever know what it's like to go through this shit. You will never know what it's like to experience it. And I don't care who I have offended by saying that, because it's the motherfucking truth. Be offended if you want to. I don't care. Argue with your mama, not me. Okay? And also, Menopause hormone therapy can result in light bleeding or bleeding that's as heavy as a normal period. If your bleeding concerns you, see your doctor, okay? See your doctor. Other causes of bleeding after menopause can include thinning of the tissues that line the vagina and uterus due to a decrease in estrogen. So that's another reason why it's important to keep your estrogen levels up and in a range that they're supposed, in that range that they're supposed to be at, which I don't know, but I know it's important to maintain them. Uterine polyps are another cause. Infections of the uterus, such as endometriitis. I'm sorry, y'all. I took med term and still could not say that word. That's insane. Or cervicitis. Also, abnormal growth of the lining of the uterus, which is also known as endometrial hyperplasia. And the last one that I saw was endometrial cancer. So, yeah. Menopause brings on a whole set of internal issues in women. And it doesn't care what color you are. It doesn't care what country you live in. It does not care how much money you have or don't have. It doesn't matter who you are. As a woman, you're going to experience it. It's going to happen. Now, this is research that I came across from Johns Hopkins, and it states here that the average age of menopause is 51, but can actually happen anytime from the 30s to mid-50s. Now, earlier, remember I said it can happen between, once you reach your 40s, from age 45 to 55. But Johns Hopkins says it can start from any time from the 30s to mid-50s or later. Women who smoke and are underweight tend to have an early menopause, while women who are overweight often have a later menopause. Generally, a woman tends to have menopause at the same age as her mother did. Now, my mother had a hysterectomy when I was a little girl, so I don't know if she went through that at all. I have no idea. I was very little when that happened, so I don't know. And like I said, my mother passed away so early in my life. These are questions that I never even got to ask her. Another one, I'm sorry. Menopause can also happen for reasons other than natural reasons, and these reasons include premature menopause. Premature menopause may happen when there is ovarian failure before the age of 40. It may be associated with smoking, radiation exposure, chemotherapeutic drugs, also known as chemotherapy, or surgery that impairs the ovarian blood supply. Premature ovarian failure is also called primary ovarian insufficiency. Yeah. So, not only can menopause occur naturally, but it can be induced by unnatural things. And another one is surgical menopause. Okay. It may follow the removal of one or both ovaries or radiation of the pelvis, including the ovaries, in premenopausal women. These women have more severe menopausal symptoms if they were to have menopause naturally. And that is fucking insane. That's crazy. Hot flashes or flushes, whichever one you prefer to say, are by far the most common symptom of menopause. About 75% of all women have these sudden, brief, periodic increases in their body temperature. Usually hot flashes start before a woman's last period. For 80% of women, hot flashes occur for more than 2 years. For more than 2 years. That's so fun. Yay. They seem to be directly related to decreasing levels of estrogen and varying frequency and intensity for each woman. Woo-wee. Yeah. Okay. This is just so much fun. Yeah. I love being a woman, but like I said, the shit that we go through internally is crazy, and it's a lot. In addition to the increase in the temperature of the skin, a hot flash may cause an increase in a woman's heart rate. This causes sudden perspiration as the body tries to reduce its temperature. This symptom may also be accompanied by heart palpitations and dizziness. Hot flashes that happen at night are called night sweats. Now, I have night sweats, and they are the fucking devil. Night sweats, oh my God. They literally wake me up out of my sleep. Like, I'm waking up snatching off my damn bonnet. Like, anything that I can take off to make me cool down, I do it. And it's usually the first thing to come off is my bonnet, because I sweat in my head really bad. Like, when I'm hot, the first thing on me that goes to sweating is my head and then my nose. Like, I cannot take being hot in my hair. Like, my hair gets so sweaty and I'm drenched in sweat. It's wringing wet. It's really bad. And it also says that a woman may wake up drenched in sweat and may have to change her night clothes and sheets. It's so bad for me. I don't know. Like, some people wake up in the morning, they like to take a shower. For me, I like to take my showers before I go to sleep. It just helps me sleep better. But baby, when I have a night sweat, I have to wake up and get in the tub. Like, I don't care if I took a bath, even though I took a bath or showered the night before. When I have those night sweats, I have to wake up and take another shower. Because I'm so sweaty and sticky, it's like I've been out in 95-degree weather all goddamn night long, just sitting there. That's how hot I get. So I don't know if any of y'all who are listening, any of the women experience night sweats, but they're horrible. They are fucking horrible, okay? Vaginal atrophy is the drying and thinning of tissues of the vagina and urethra. This can lead to pain during sex, as well as vaginitis, cystitis, and UTIs. Relaxation of the pelvic muscles. Okay, this can lead to urinary intercourse and also increase the risk of uterus, bladder, urethra, or rectum protruding into the vagina. Oh my God. Y'all, when I read that, oh my God, when I read that, I was blown away. Blown away. Let me read that again. Relaxation of the pelvic muscles can lead to urinary intercourse and also increase the risk of the uterus, bladder, urethra, or rectum protruding into the vagina. Face palm. Oh my God. Yeah. I still am in like disbelief. Like, I didn't even know that. That's something I did not know. I don't know if any of y'all knew that, but I had absolutely no idea. Cardiac effects. Intermittent dizziness, and abnormal sensations such as numbness, prickling, tingling, and or heightened sensitivity, cardiac palpitations, and fast heart rhythm may occur as symptoms of menopause. So menopause doesn't just affect you temperature-wise, as y'all are learning. It has all these other effects that it takes on your body, or that it could possibly take on your body. And that's why I feel that this conversation is so needed, and more of them need to be had. And I just don't understand why it's not really being talked about, at least the way that I feel that, it should be. I don't see it a lot and I don't hear about it a lot. I don't. Hair growth. Changing hormones can cause some women to have an increase in facial hair or thinning of hair on the scalp. Now, this facial hair shit is real, okay? Because why do I got like a little 5 o'clock shadow on my top lip? That ain't cool. That ain't what's up. And then I have this one hair that grows under my fucking chin. And as soon as I feel that bitch, I start pulling at it and I pull it right on out. And y'all, one time I forgot about it and that motherfucker got so damn long. I was like, oh my God, have I been walking around like this? I pulled that thing out so damn fast. Yeah, I know there are a lot of women who have facial hair and you can't control it. It happens for all types of different reasons to different women, and some women accept it. I'm not accepting it. I don't want it, so I will be removing it because I'm not embracing facial hair on my fucking face. I'm not. Okay? I'm sorry if somebody's offended by it, but I meant what I said, and I'm standing on it. I'm never going to embrace that, ever. And anything that is going to help me get rid of it, I'm going to fucking use it. Mental health. Now, this is something that I really found, I was really hoping to come across, because mental health is very important. It's extremely important. While it's commonly thought that mental health may be negatively affected by menopause, several studies indicated that menopausal women suffer no more anxiety, depression, anger, nervousness, or feelings of stress than women of the same age who are still menstruating. Psychological and emotional symptoms of fatigue, irritability, insomnia, and nervousness may be related to both the lack of estrogen, the stress of aging, and women's changing roles. Now, I know for me, my emotions are all over the place. Some days I'm having like the greatest day, and that'll last all day. Some days I'm having the greatest day, and at some point during the day, I feel like I want to burst into tears. I feel like I'm just on this emotional downward like spiral, and get so frustrated because I don't understand why I'm just all of a sudden now so sad and so like irritated and like just getting almost angry. Like it's so annoying. I don't like feeling that way. I like to have the best day that I can possibly have every single day. And I just don't like feeling extremely happy for most of the day, and then I get into this mood where I don't want to be bothered. Like, well, I'm a Gemini, so a lot of times, some days I don't want to be bothered anyway. But what I mean, like, as far as menopause is concerned, because I am perimenopausal, my emotions are just crazy right now. They're out of whack, and I'm going to see if there's something that can be done about this, because I don't like it, and I'm always tired. I don't care what time I go to bed. I'm always fatigued, and I don't like that either. So yeah, I want to see what can be done about this, because I like to have a good day every day, and I know that there are days where we all have moments that are not so good. But I remember Deion Sanders saying, he said, I don't have bad days ever. I have bad moments, but I don't ever have a bad day. And that is something that I have tried to live by, because I don't want to have a bad day. I always want to have the best day that I can possibly have. And if I can do that, I'm ecstatic, because I try to find something to be grateful for, to laugh and smile about every single day. But when you're going through this, it's hard because you don't know why you're fucking sad. Like, it's crazy. Sometimes I do know why I'm feeling, down. I might be thinking about my mom or my brother or, my aunt or, just, certain things that I'm dealing with, in my life, in my personal life. But I'm able to pull myself up out of that and get back to having a good day. But when it has to do with just a random burst of sadness or irritation or anger, frustration, like, it's annoying. I'm annoyed. I become annoyed with myself. So I said all of that because I don't know. I'm hoping that it might help some woman who's listening, someone or a woman rather. If it just helps just one woman, that is my goal. And that was my goal when I decided to do this series on menopause. I don't know how many parts there will be right now, but I feel like as a woman, because I wasn't hearing the conversations or seeing the conversations enough, that I should do my due diligence and do my, and put something out there, because I feel that when you are not satisfied with something and you want to see a difference, then you need to be a part of the change that you wish to see. So I felt like this is something, I wanted to learn more about. And I'm sure that there are women out there who would like to know more about it also. Some women may feel like no one cares. Some women may feel like, they don't want to talk about the things that they're experiencing. They might be ashamed. I don't know. Some women just might feel alone. Like, sometimes I feel really alone in this world, and I'm not even gonna lie. Sometimes I do, with the shit that I go through on a daily basis. When you walk the earth without your mother, the longer you do it, it does not become any easier. It becomes tolerable. It doesn't. I've never had an easy day without my mother, especially when I'm going through something like this. I don't have anyone to call. I don't. And it's just crazy. It's crazy. And I shouldn't say I don't have anyone to call, because I know that I have women that I could call. But it ain't nothing like your mama. It's just not. I'm just going to keep it real. It ain't nothing like your mama. Okay? And I can't talk to my dad about menopause. Like, he's an 83-year-old man. Like, yeah. So anyway, that's going to conclude this episode for the first part of my menopause series. So if y'all enjoyed this, if it was informative for you in any way, please let me know. At the end of the episode, you can give your feedback, and it is greatly appreciated. I would love to hear from you. And I'll be talking to y'all again soon. So have a great day on purpose. Find a reason to smile. Find a reason to be grateful, thankful every single day for what you have, so that you can be blessed with more. And that's a wrap.